So now we're going to talk about the causes of Nervus Trigeminus lesions. Causes of the unilateral lesion. A higher central lesion, for example, a cerebral or ophthalmic lesion, will be contralateral to the clinical findings. And by that, we mean relating to or denoting to the side of the body opposite to that on which a particular structure or condition occurs. A hemispheric infarct of the middle cerebral artery territory may produce sensory loss in the trigeminal distribution on the same side as the hemiparesis. With hemispheric lesions, masseter strength is usually preserved. The supranuclear control of the trigeminal nerve motor functions are bilateral, so a hemispheric infarct is never going to produce a unilateral lesion, although voluntary control of the masseter will be lost. Brainstem lesions would be ipsilateral, meaning belonging to or occurring on the same side of the body. Examples of this include a pontine stroke in the lateral rostral pons or above with ipsilateral body sensory loss, a medullary stroke in the lateral medulla with contralateral body sensory loss, raised intracranial pressure, a false localizing sign, mid-pontine stroke, ipsilateral pons, if only the face is affected. Isolated masticatory motor failure suggests that the lesion is limited to a small area of the mid-pons. And of course, let's not rule out pontine tumors. A peripheral lesion may be specifically affecting a single branch. A sensory lesion confined to a branch distribution suggests that the lesion cannot be nuclear. In essence, it must be somewhere beyond the trigeminal ganglion. This can be due to craniofacial trauma, base of the skull fracture, maxillary sinusitis, a tumor, an aneurysm of the internal carotid artery, or even cavernous sinus thrombosis. Now, the causes of isolated bilateral lesions. Bilateral lesions are freakishly rare in isolation. You might find them in diabetic neuropathy, large pontine tumors, or extensive cavernous sinus thrombosis. Obviously, bilateral absence of the corneal reflex is expected to be in the context of brain death. The most common causes are extracranial and include damage following trauma. For example, this could be assaults and accidents, or orthognathic surgery, which is also known as corrective jaw surgery or simply jaw surgery, and it's designed to correct the conditions of the jaw and the lower face related to structure, growth, airway issues, including sleep apnea, malocclusion problems, primarily arising from skeletal disharmonies. That you could also have cancer, third molar surgery, and disease in the bones such as osteomyelitis, malignant disease, or Paget's disease, and certain drugs, diabetes, and also conditions like multiple sclerosis. Now, intracranial causes are uncommon but serious and include things like trauma, including surgical treatment of trigeminal neuralgia. So trigeminal neuralgia usually occurs spontaneously, but is sometimes associated with facial trauma and dental procedures. The condition may be caused by a blood vessel pressing against the trigeminal nerve, also known as vascular compression. In addition, inflammatory disorders such as sarcoidosis, infections such as HIV or syphilis, and connective tissue disorders, malignant disease, cerebrovascular disease, drugs, diabetes, syringobulbia, multiple sclerosis, benign trigeminal neuropathy, whose etiology is actually unknown, though some patients do prove to have connective tissue disorders, and of course, let's not forget psychogenic causes. Trigeminal pathology may cause ipsilateral pain as well as sensory loss. In the trigeminal trophic syndrome, also known as TTS, can be caused by trigeminal neuralgia surgery, lateral medullary infarction, also known as Wallenberg syndrome, or zoster. Wallenberg syndrome is a rare condition in which an infarction or stroke occurs in the lateral medulla. The lateral medulla is a part of the brainstem, and oxygenated blood does not get to this part of the brain when the arteries that lead to it are blocked, so a stroke can occur due to this blockage. So let's talk a little bit about the symptoms of Wallenberg syndrome. You might find pain and temperature sensory loss on one side of the face as well as on the opposite side of the body. Rapid involuntary movement of the eyes, also known as nystagmus, problems with balance, gait and coordination, vomiting, vertigo, dysphagia and hoarseness. Also, a quick tip, gabapentin may be effective therapy for Wallenberg syndrome. Unilateral chin numbness, which is also known as numb chin syndrome. It's a condition where there's altered sensation along the distribution of the mandibular branch of the trigeminal nerve, without any obvious odontogenic cause. NCS commonly presents as an anesthesia or paresthesia over the chin and is usually unilateral. This may be caused by malignant infiltration of the inferior alveolar nerve by jaw metastases or a local tumor, mainly lymphomas or breast cancer. Infections such as osteomyelitis may also play a role. A metastatic deposit at the level of the base of the skull involving the mandibular division of the trigeminal nerve, metastases to the meninges or as a part of a paraneoplastic syndrome. Bilateral chin numbness or circumoral numbness may be caused by hyperventilation, hypocalcemia or syringobulbia. Well, I think that was a lot of information, so how are you going to memorize it? Don't worry about that, because we've prepared a little way for you to memorize these causes easily with the help of a mnemonic. So first we need to categorize all the causes. Now you can memorize the categories using the memory of the fruit lychee. So L for lesions, I for intracranial issues, T for trigeminal pathology, C for common causes, and CHI for chin numbness. Now let's go into the sort of detail of these. We've got certain mnemonics for these lesions. The L for lesions, we can remember it using the mnemonic PUB-B. P being for peripheral lesions, U for unilateral lesions, B for bilateral lesions, and the last B for brainstem lesions. Now for intracranial issues, we can further remember these using BPM, CD, MITS. Now I know it sounds quite long, but it has a little ring to it, I suppose you could say. So the B is for benign trigeminal neuropathy, P for psychogenic causes, M for malignant diseases, C for cerebrovascular diseases, D for drugs, M for multiple sclerosis, I for inflammatory disorders, T for trauma, S for syringobulbia. Now moving on to common causes. We can remember these using a simpler mnemonic, COD data. So the C would be for cancer, O for orthognathic, D for drugs, the second D for disease in bones, A for assaults, T for third molar surgery, and A for accidents. I hope you guys might find it helpful to learn these causes slightly more easily using these mnemonics.